Your Excellency, the President of the Republic of Kenya, Chief Patron, St. John Ambulance Kenya, Dr. William Samoei Ruto, CS, Honorable Adan Duale, PS, State Department for Public Health, Madam Muthoni, Governor Taita Taveta, St. John Council members, guests, volunteers, and cadets. Your Excellency, today we gather not only to honor and celebrate the achievements of our volunteers, but also to reaffirm our commitment to serving humanity and saving lives. This annual St. John Day is celebrated on the 24th of June every year as one of the most important events in the calendar of St. John, bringing together volunteers worldwide to honor their exceptional service and renew our dedication to the communities we serve. On behalf of the Priority Council, Your Excellency, our volunteers, cadets, staff, members of the Council across the country, I extend our deepest gratitude to Your Excellency for graciously hosting us again at these grounds. Your steadfast support continues to inspire organization and reinforces the important role that volunteerism and humanitarian service play in nation building. Your Excellency, this year 2025 marks the successful completion of our strategic plan 2021-2025, a period characterized by resilience, innovation, institutional strengthening, and expanded humanitarian impact. Throughout the year, Your Excellency, St. John Ambulance continued to advance its mission through emergency medical services, first aid training, community health programs, and volunteer development, especially youth empowerment. In 2025 alone, Your Excellency, we trained 254,754 Kenyans in first aid, emergency preparedness, and community response skills. These trainings equipped individuals, schools, institutions, workplaces, and communities with the knowledge and confidence needed to respond effectively to trauma and other emergencies. Your Excellency, among these over 62,000 volunteers, there are schools, colleges, universities, and corporate organizations. Your Excellency, one of the strengths that the Priority has over the other 43 global St. John establishments is that 80% of our volunteers are youth. This gives St. John, Kenya, an opportunity to mold the youth into not only being responsible and patriotic citizens, but also holding firmly the moral fabric of our society. We are alive to the fact that the youth will play a very critical role in the digital and creative economy, which is one of your government's pillars in the bottom-up economic transformation agenda. We have held discussions with other priorities, notably New Zealand, Malaysia, Australia, Hong Kong, and Singapore, on how our youth can engage in exchange programs. And Your Excellency, this August, over 100 of our youth will be visiting Malaysia to take part in that program. Beyond the numbers, Your Excellency, St. John Ambulance Kenya remains committed to carrying out community health programs across the country. This, Your Excellency, is being carried out through the Highway Emergency Response, the Mama na Mwana project, all of which we have received immense support from the Ministry of Health, especially the State Department of Public Health and Professional Standards. The Honorable CS for Health and the Principal Secretary have been very welcoming whenever we have requested for a meeting with them. We are really thankful for this support and we shall endeavor to support the government on this. These two projects align with the universal health coverage pillar in the primary healthcare, Your Excellency, which is one of the key pillars in the bottom-up economic transformation agenda. At this juncture, Your Excellency, let me mention the critical role the community health promoters that your government established 3 years ago is playing in these key projects that we are engaging in. One of the key milestones achieved during the year was the continued implementation of the Highway Emergency Project, launched in partnership with the Government of Kenya in November 2025. We thank your government for supporting us during the launch of this project that aims to strengthen the emergency response along major highways and transport corridors through improved coordination, enhanced first aid response capacity, and faster response times for emergencies. Your Excellency, if I may mention, we are doing this also in collaboration with the county governments along the highways, and we have had several meetings with them. And Your Excellency, let me thank one of the governors, heads of counties, that is the governor for Taita Taveta, who has allocated us 2 acres of land to carry out this project. These are some of the projects that St. John Ambulance continues to make a difference in the society. Your Excellency, ladies and gentlemen, equally significant has been the progress through our Mama na Mwana maternal health project in Kajiado that is supported by our head office in London. It has been identified among one of the projects to support, and currently we are rolling out the project in Kajiado County. Your Excellency, these realities make targeted community-based interventions and primary health care necessary and impactful. In the past 1 year, the Mama na Mwana project has directly reached 4,003 mothers and children through maternal health education, community outreach, and referral support systems. Also, in partnership with this, we have also reached the men, that is the partners or the husbands of these mothers, and we have managed to reach 29,000 of community members for this project. Your Excellency, ladies and gentlemen, as Kenya continues to transform its healthcare system, St. John Ambulance stands ready to play an even greater role in supporting national health priorities. We commend the government for implementation of the Social Health Authority, the Emergency Critical and Chronic Critical and Illness Fund. That is, we have been assured by the CS for Health that it is going a long way to enable sustainability of our highway program. These initiatives are creating stronger foundation for universal access to quality healthcare and improving health outcomes for millions of Kenyans. Your Excellency, ladies and gentlemen, St. John Ambulance possesses a unique combination of emergency medical expertise, volunteer capacity, community outreach experience, and nationwide presence. We therefore look forward to deeper collaboration with the Ministry of Health and county governments to embed St. John Ambulance Kenya within these transformative programs. And Your Excellency, we commit to support your government on these pillars. As we embark, Your Excellency, on the implementation of our strategic plan 2026-2030, we do so with optimism and determination, guided by our pillars for this strategic plan of proper governance, enhanced community health programs, sustainability for the organization, technology and innovation, and volunteer and youth empowerment. We envision a stronger, more responsive, technologically advanced St. John Ambulance, Kenya. Our goal is to scale emergency program systems, strengthen volunteer capacity, and expand healthcare and humanitarian programs, deepen strategic partnerships. Your Excellency, we have several corporates who have really supported this program and St. John Ambulance as a whole. And just to mention a few, we have Kenya Ports Authority, which has St. John membership, the Kenya Railway, Kenya, we have Kengen, we have the Sarova Hotels, and the General Service Unit. Your Excellency, allow me to express my sincere appreciation to the government of Kenya, our partners, donors, sponsors, and most so these volunteers and friends of St. John who support our work. Your confidence in our mission enables us to respond to emergencies, train communities, empower volunteers, and sacrifice continue to define the spirit of St. John that inspires us all. Your Excellency and our Chief Patron, distinguished guests, ladies and gentlemen, together we continue building a safer, healthier, and more resilient Kenya. May God bless St. John, Kenya. May God bless our patron, the Chief Patron, Your Excellency the President, and the Republic of Kenya. Thank you, ladies and gentlemen.